Happy New Year, guys. I hope you're fine, kept by the Lord. I'm also kept by the Lord. I thank God. This week I had a little bit of a setback. I had a sty on my eye. You can see it. It's been a little bit painful, but right now I'm glad to God it's healing. I had a very bad headache yesterday, guys, but it's just a testimony. And I imagine I had some online training interview to do at 1:30 a.m. I had a service to attend. Throughout the service yesterday, fellowship was just holding my head, but I mean the grace of God was sufficient. I was able to do the interview and I finished. So I love reading my Bible, actually, and today just a word that encouraged me was in Matthew chapter 14. But before I go to that, I'm currently rotating in my orthopedics, and it's fun. I've been able to see many things that affect people. Na kitu moja ambayo nimeona, one thing that I have seen is a disease of the joints, and I realized that many people complain about having pain in their joints, having problems. So there's a disease we call osteoarthritis. Most of you have heard, oh, flani ako na arthritis, so and so has arthritis. Now what happens is that osteoarthritis is a disease, is a chronic disease, meaning it won't just come suddenly. So it affects your joints. Now people will complain of pain. So and this osteoarthritis, it's how do I put it, the older you are, the more at risk. So when I was rotating in the clinics, I found out that most people that were coming, most patients who were diagnosed with osteoarthritis, actually most of them were elderly. So the more elderly you are, above the age of 40-45 years, then there is a risk, there's an increased risk. So how will osteoarthritis present? You tend to have pain in your joints, knee joints. In elderly women, it can involve multiple joints, so you tend to have pain in the joints. And then this pain is characteristic. If you exercise a lot, it tends to be aggravated, it's increased. But then when you rest, the pain is relieved. And then another thing is that when you rest and you have osteoarthritis, as you wake up from the rest, you tend to have joint stiffness. Yes, as you wake up from the rest. So in severe cases, osteoarthritis might end up giving you joint deformities. You get deformities, and then you see around our joints you have muscle. Of course you have muscles around that area, not inside the joint, but just muscles around the area tend to be wasted. And when you go to the hospital, they'll take something we call an x-ray to try and see what is happening in your joint. Treatment for osteoarthritis, mostly painkillers to relieve the pain. Then I've told you it affects the joints. You can even reach to the extent where because of how severe it has been, you cannot walk, your joints are affected. And so physiotherapy is also of help relieving pain. Physiotherapy is also of great help. And then at the end of it all, when it's so severe and nothing can be done, joint replacement tends to be the solution. And something else, there's this patient who came and was obese and was diagnosed with osteoarthritis. One thing I saw my consultant advising her was to also try and lose weight. So guys, exercise will really help a lot. And that is it about osteoarthritis. If at all you've been struggling with pain in your joints, as you exercise the pain is worsened, when you rest it's relieved, but then when you wake up from the rest you find joint stiffness, it will be good for you to go and seek help. The best person to deal with the case of osteoarthritis is an orthopedic surgeon, and there are so many at the University of Nairobi, qualified people. If you need any leads to that, you want someone to have a look at your joints, you feel you have a problem with your bones, just text. I'll be glad to direct you, to give you options, and you can choose from that. So guys, I was telling you about Matthew chapter 14. It was about the feeding of the 5,000 people. What I realized was that, you see, in this story, when it's almost late, the disciples are like, Jesus, release these people because we don't have enough to keep them. And Jesus says, no, give them something to eat. And they're like, the only thing we have are 5 loaves and 2 fish. But then Jesus says that is sufficient, because he trusts in the Lord. He prays, he gives thanks. and that amount of food is able to feed everyone, meaning there is multiplication. And what I have been thinking about is, at times God has blessed me with some things, but I'm like, this is too small, this can't help me to reach here. Like, this is too small, this can't help me to maybe get this job or get this thing. Please, whatever is in your disposal, however small it is, God can use it to take you far and to provide for your needs. Otherwise, guys, for those that have continued supporting me and subscribing to this channel, thank you so much. Thank you so much. So over a couple of the next few weeks, I'll mostly be presenting to you cases, orthopedic cases. Na Mungu awabariki sana. Ninawapenda sana sana na sana. Have an awesome, amazing, fantastic, fabulous weekend. Bye bye.